Nearly 1 in 5 pregnant women and people may be offered and then make the choice to have an elective caesarean section. The reasons this happens might vary, but it's usually to do with having a high-risk pregnancy for some reason. For example, you might have had a caesarean section in the past, or there can be a variety of other reasons as well. Each hospital and each individual woman and pregnant person are different, so please do ask your own caregivers about how things work in your hospital and for your particular circumstances. That said, I hope that the following I'm going to discuss with you now will give you an idea of things that you might want to think about when it comes to preparing for your elective caesarean section. Please do be aware that depending on how busy your hospital is, there is always a small chance that the date of your booked elective section might change. If you think this would be especially distressing for you, please do ensure to have this conversation with your consultant so they can take this into account when they are looking after you and providing care for you. Sometimes that change of the elective caesarean can happen even on the day that you turn up for your elective caesarean section, although I do want to emphasise this would be a rare situation to happen. For an elective section then, you'll be invited into the hospital generally a few days before you go in to give birth. You'll be asked to go over some paperwork and look at the consent forms and sign those consent paperwork with the doctors. You'll have some bloods taken, and this is a really great opportunity to ask any questions if you still need any help with any answers. They might give you some medication that you'll need to take either the night before and the morning of your caesarean section. Generally, you'll be asked to drink only clear fluids from midnight the night before until early morning on the day of your caesarean, but do ask and check this is the case for you. You can ask beforehand about where you'll be waiting to have your surgery and where you'll recover afterwards. This can help you to visualise what will happen and can help you to feel calmer about the whole situation. On the day of your elective, you'll be invited to come in and wait for your operation. Checks will be done such as on your baby's heart rate, the baby's position, and they'll take your observations. You'll usually be given a hospital gown and some stockings which will help to reduce the risk of a blood clot in your legs. You'll be given an ID and an allergy band if you need one. With your permission, a cannula will be inserted. Normally this is in the back of your hand or in your wrist, and sometimes it might be in your elbow as well. And this will be so that IV fluids and drugs can be given as needed during and after your surgery. You can usually take one birth partner in with you to the elective section who can support you and be there when your baby's born. But again, check this is what happens and where your birth partner will need to wait. Generally, your partner will be given some scrubs to wear and potentially a hat, or they will be given a hat to cover the hair, and they can usually get given sort of some little foot covers to cover their shoes while they're going into theatre. Before the caesarean section day, it's important to ask your midwife or consultant to talk you through exactly what happens step by step. This will help you to feel prepared and will also give you an opportunity as you hear what happens to tell them about any adjustments that you might need to help you to manage that sensory environment and your own information and communication needs. For example, you might want to discuss the language that's used in front of you. You might want to say that you want your partner to play some music near you on a phone. Or you might want some help subduing the lighting that's over your face if bright lights are going to be difficult for you to manage. The important thing to remember is that this is your experience and things can be done to help you have the best experience that you're able to while still maintaining the safety of you and your baby. So before you have the operation, you will generally need an anaesthetic. Generally, this is a spinal block which is placed into your back. The anaesthetists and their assistants will help you to understand how you need to sit to have this put into place. A local anaesthetic injection will be used before they use the spinal injection or epidural if that's what they're going to insert instead. And again, do ask for a step-by-step understanding of what the processes and procedures are in your hospital to understand that you feel prepared for this. They will also ask for your consent to have inserted an indwelling catheter. This will help to keep your bladder empty during the surgery and afterwards as well until you are able to mobilise the toilet by yourself. You'll be taken to theatre where your baby will be born, and drapes will be placed above your chest to avoid seeing the surgery and to help to maintain a sterile area for the surgeons. The anaesthetist will be at your head end and will monitor your well-being closely, giving you any fluids and drugs that you might need, and they are really helpful as well for answering questions during the surgery. Ask your midwife to help you to understand what will happen after your baby's birth as well. So again, you can have any adjustments made that you want to. Generally though, after the baby is born, you and your birth partner will be able to meet your baby and have some time with your baby in the theatre This can include skin to skin time. Obviously you've got the drape, so it'll be more likely on your chest side, but often you can have that skin to skin fit in theatre if this is what you would like to do. You'll then be stitched up during that time, and after that's all been done, they will help you onto a postnatal bed and help you to get a wash down. Your urinary catheter will need to stay in place usually for about 6 hours, but it might be longer dependent upon your needs and the situation in the hospital. You'll then be taken to somewhere to recover, where the midwife will support you to have some skin to skin time with your baby if this is what you want to happen. They will also support you with feeding your baby for the first time, whether that's breast or whether that's a bottle feed. And they will continue observations based on the protocol they use at the hospital. So that will be things like your blood pressure, your pulse, your respiration, and checking your blood loss, which they might call your lochia, and also checking that your wound dressing is clean and dry.